Is it safe if you have breast cancer risk because of your family history or because you have a genetic specific predisposition to breast cancer to use hormone replacement therapy? Well, that is a very loaded question and it's highly individualized. It depends on each patient because your risk is not the genetically determined test that tells you, hey, your risk is 40% as opposed to a normal, let's say 12% at the age of 80 or much lower as you're younger, right? So the epigenetics, which is what we eat, how much we exercise, how we detoxify our bodies, what do we do with the hormones once we have them in our bodies, whether we have them naturally or we introduce them as form of hormone therapy, it is very, very important. And you can test for that. You can test for hormone metabolites in the form of Dutch testing to see if you're shifting estrogens into bad estrogens or you're shifting your testosterone into bad estrogens or bad androgens, and whether or not you have enough progesterone to balance all this out. You can also look at the big picture here. Do you have inflammation, which is going to increase your risk of cancer, independent of any hormones or no hormones? So I like this analogy, and I kind of use it a lot. When you have an increased risk of a cancer, you still, if you're miserable and you have a horrible quality of life, and nothing other than hormone replacement therapy is going to get you out of it, you have to look at the big picture. The freeway is full of crazy drivers. So if you get behind the wheel of your car because you need to go from point A to point B, and we all drive in California every day, long distances, and there's a lot of bad drivers out there, you don't think for 1 second that you could end your life right then and there that day because of a bad accident on the freeway. However, there is a chance of that happening. And if you live with that fear over your head your entire life, then that's a whole different situation. You wouldn't get behind the wheel of a car if that would be the case. So what I'm saying is not that hormones are willy-nilly good for anybody who has a higher risk of cancer, but they're not necessarily something to be written off as, oh, I cannot use or I should never try. So it's very important why you have an increased risk of cancer and how can you mitigate that increased risk of breast cancer. What are you doing with your diet, with your exercise, with your detoxification, with your stress, with your sleep? What does your immune system look like? What are your vitamin levels? All of these are crucial factors that are going to determine whether or not you actually get breast cancer.